Randomized controlled trials are a way to study the safety and efficacy of treatments. They are required by governmental regulatory bodies as the basis for approval decisions. Randomized controlled trials can demonstrate superiority of a new treatment, such as a medication over an existing treatment. They provide the highest level of evidence. Randomized controlled trials basis is the study protocol, which has a primary question, describes the background, risk-benefit assessment, study design, study methods, overall planning, conduct, and analysis. For the primary question to be answered, there must be a primary endpoint. This is a reflection and measurement of the effectiveness to a treatment. Patients in the trial receive either another treatment or a placebo. The use of placebos are ethically justified if no standard treatment is available or if comparison with the placebo is necessary for methodological reasons. It can be justified if the patients will not be harmed. The study population must be clearly defined and inclusion and exclusion criteria must be detailed. Patients are randomly assigned to different study groups to ensure that all potential confounding factors are divided equally. Predictability of group allocations are avoided by ensuring staff are unaware of which treatment will be allocated to the next patient. This study is a randomized controlled trial that compares the combination of midazolam and morphine to just morphine in suspected acute coronary syndrome patients in the pre-hospital setting. A total of 1,763 who were suspected of ACS were included in the analysis. There were 890 patients that were involved in the randomized controlled trial of midazolam and morphine, and 873 patients who had morphine on its own. The inclusion criteria for this study was a pain raising suspicion of ACS and a pain score of 4 or more. The exclusion criteria included a systolic blood pressure less than 100, under 18 years of age, influence of alcohol, benzodiazepine abuse, dementia, disorientation, communication issues, and symptoms that were caused by trauma. The study took place in Western Sweden with 5 EMS organisations involving 500 pre-hospital emergency nurses, 60 ambulances and a boat. Ethics were approved by the Research Ethics Committee in Gothenburg and pharmaceutical approval was provided by the Medic Products Agency in Stockholm. Informed consent was obtained from each patient. The study started on the 1st of May 2008 and the last patient was recruited on the 31st of December 2010. The randomization was conducted as an envelope method with the patient's written consent. The envelope consisted of a note that stated whether midazolam was to be administered to the patient. All patients received morphine as the standard treatment. This study was not a blinded study, it was open.